That was Chris Ochambringa reporting there. Now with me now is Dr. Daniel Lucey. He teaches in the Department of Microbiology and Immunology at Georgetown University Medical Center, and he has extensive experience traveling to areas of the world with infectious disease outbreaks. Dr. Lucey, Chris mentioned there the fourth strategy response plan, SRP. What does that entail?
Yes, so the strategic response plan number 4 is the guiding document for the rest of this year through the end of December of 2019 for how to control this Ebola epidemic. There have been 3 previous strategic response plans over the past 12 months, and this fourth one begins today.
Is that everything, including what we saw there, public hand washing facilities that are being provided, education efforts? Is all of that encompassed in this plan?
Yes, it is. It's divided into several different pillars, but that's basically a comprehensive plan in addition to a budget, a detailed budget for the next 5 months or so.
There's already a vaccine out there that's been proven effective, and indeed a second one as well to back that up. Why isn't it getting to people or to enough people?
So both vaccines that you referred to are still investigational in terms of they're not approved by any regulatory body, not the U.S. Food and Drug Administration or the European regulatory body or any African regulatory bodies. So they're not licensed. But the first one, which has been given now to over 180,000 Congolese in the last 12 months, does seem to be quite effective when it's given to people who are in contact with someone with Ebola. So it's given, for the most part, after exposure, which is different than the usual way vaccines are given. The other vaccine that you mentioned requires 2 shots, not just 1 shot, 2 shots 2 months apart. And that vaccine has not been tested yet in a single person in the Congo, although in over 6,000 people in other places.
We heard, though, that there are fears or perhaps even disbelief in Ebola or religious beliefs that are preventing some of these people from getting that. Is that a real problem in terms of health treatment here?
Well, I think it was a problem in West Africa in 2014-15. The 3 countries that were involved with Ebola, the worst ever Ebola outbreak. Now this is the second worst ever out of 28 outbreaks. And so, yes, there is problems with some people in the multiple different communities in the northeast Congo where the outbreak's occurring in terms of believing that the disease is caused by this virus. But the fact is that many people have gotten the vaccine, over 180,000. That means that they do believe that it's due to a virus.
Rwanda closed its border for several hours and then it reopened it. And they did so closing it against the advice of the World Health Organization. Why did Rwanda's President Paul Kagame do that? Was that political pressure, or is there any medical reasons for doing so, in your opinion?
Well, so in my opinion, because I can't speak for for the President Kagame, of course, so I don't know the reasons. I wasn't surprised that it occurred, but it was what I was happily surprised about is that it was only a matter of hours. And then the Ministry of Health of Rwanda put out a statement today saying that the border is in fact open. And my translation of the French was that it was simply a sort of a slowdown this morning. It wasn't a full border closure. Slowdown so that they could increase the screening of patients for possible Ebola symptoms at the border. But the main thing is that the borders reopened and it was only a matter of hours.
Ebola in Goma is a game changer. Why?
Well, that's what Dr. Tedros, the head of the World Health Organization, called it on July 15th, a game changer. That's with the first patient after 11 and a half months in Goma. Now, as of today, there's been 4. The second, third, and fourth, all related, same family. The man who was a gold miner got infected. He came back to Goma from the north and unfortunately infected his wife and one of his 10 children that we know about so far. And to the best of my knowledge, all 4 of those patients have died. So why could it be a game changer is because Goma has an international airport, which none of the other cities or places that the outbreak has been occurring has. And also it's right on the border with Rwanda, and many people go back and forth for work and other reasons every day between Goma and the city within Rwanda that's just across the border.
Dr. Daniel Lucey, thank you for joining us with your insight.
Thank you so much, Roee.